Hi bestie, this is Health-ish and I am Dr. Chi, and today I just want to tell you that men have breast tissues. Yes, they might not have protruding breast or pendulous breast or standing breast or whichever terminology you want to use, but they might not have it as women do have, but men have breast tissues and they can undergo cancerous mutation. So when there is breast cancer, what happens is that cancerous cells, in layman terms, cancerous cells proliferate, and when they do proliferate, they mutate and grow beyond control, and so they don't also die, so they don't have apoptosis, so they just proliferate and beyond control and are found in the breast tissue. So basically breast cancer is a proliferation of cancerous cells in the breast tissues, and when not detected early, they can keep proliferating, and because they don't die, like they don't have or undergo apoptosis, they just continue to grow, multiply until they start spreading to other parts of the body. Have you seen any man, or do you know any man with breast cancer? Please drop it in the comment below. I'm really interested to know, and I'll read every single one of them and respond. All right, so let's talk about the symptoms of breast cancer. The symptoms of breast cancer in men are almost similar to those in women. So most times you notice that there are lumps. So the smaller the lumps, the better. So meaning that the earlier it is detected, the better. So in men, statistics have shown that these cancers in men are usually located around the nipple for men, although for women it can be anywhere. It does not also mean that for women you will not find, for men, it does not also mean that for men you will not find lump any other part of the breast, but usually it has been seen that most of the men have this lump on or around the nipple. So they also notice that they're having pain on the breast. It could be one, it could be two, but usually more is found on one breast. Some of them have nipple discharge. So this discharge might be bloody, this discharge might be purulent. So purulent meaning like yellowish, milky kind of look. Some might be foul smelling. Some might have skin affectations of these cancers, meaning that you notice that the skin on the breast is having more pronounced dots. So most times when patients come, they tell me that they notice that the skin on their breasts have dots. Some say it looks like orange. Some say it looks like that's the skin of orange. Some say it looks like the hair follicles are more pronounced. So something like that. You just notice that the skin around that breast is just off. Some people even complain of noticing a little lump in their armpits, usually on the affected armpits. So that could also be a pointer that there is a breast cancer there. So people would also notice that they are having some other signs and symptoms of metastasis to elsewhere. So you can see people complaining of bone pain, breathing difficulty. So bone pain means it has gone to the spine. Breathing difficulty means it has probably gone to the lungs and all the rest of it. So for those ones that have spread to further places, it usually means that they did not detect it early. Most times, breast cancer is more severe, more dangerous in men, meaning that the prognosis are not too good, but it's not like the prognosis is bad. So what determines the prognosis of breast cancer is actually the early detection of this. And determining the early detection of breast cancer can only be done if you examine yourself. So it has been shown, research has shown also, that early detected breast cancer, whether male, whether female, has a 99% survival rate, 5-year survival rate. Early detected breast cancer has a 99% 5-year survival rate. You can't joke with that. That's like a lottery ticket. So please, early detection is extremely important. So what are the causes and risk factors of this breast cancer in men? The truth of the matter is that the cause of breast cancer till today is still unknown, but a lot of risk factors have been linked to breast cancers. So some of these risk factors might include age. It has been seen that people that are of older age might actually have the predisposition to getting breast cancer. You also find people that have family history. So if there's a family history of breast cancer, even if it was found in the women in their family, there is still that minute chance that it could also happen in the men of the family. If there's also genetic predisposition, so the genes, BRCA1 and BRCA2 genes, have been found to be linked to breast cancer in men. I'm talking about men. So it also happens in women, but I'm talking about men in this video. So it has been found to be linked with breast cancer. And some other cancers too have also been linked to BRCA genes. So you'll be hearing situations of ovarian cancer, prostatic cancer, or they are also part of the BRCA gene cancers. So all this means that when there is a predisposition, genetic predisposition, BRCA1, BRCA2 gene, watch it. Another one is liver disease. So liver disease, especially the non-alcoholic fatty liver disease, which is also still linked to obesity, can have been found to be a predisposing factor to cancers. Then some syndromes like Klinefelter syndromes. Klinefelter syndrome basically affects the gonadal hormones, and when it does, you can find situation of that with men having gynecomastia, that is breast, like protruding breast in men. So when you see something like that, Klinefelter, any man that is diagnosed with Klinefelter syndrome has the chance of getting breast cancer. So I mentioned obesity, which is also a risk factor. So what are the treatment modalities for breast cancer? Treatment modalities for breast cancer is that it can be chemo, that is using of cytotoxic drugs to fight the cancer cells, which may be targeted. Those ones are just long stories. But it can be chemo, it can be through surgical methods, that is, if it is a lump, they surgically remove the parts of these lumps that can be seen with the eyes. Then this chemo can be given before and it can be given after, or it can be given as a combination both before and after surgery, so that you ensure that there is no recurrence of this cancer. Then there can be radiotherapy, there can also be hormone therapy. So the treatment options are wide. But please note that treatment options for breast cancer in men is a personalized treatment. It's not a one-shoot-fits-all, meaning that every breast cancer case has to be treated individually depending on the family history, the size, the site, the progression of the disease. So this will determine the kind of treatment modality that a man will get for breast cancer. So here's the tip for you that have stayed till this time. Breast examination is extremely important. It is key in early diagnosis, early detection. So how often should you examine your breast? If you do not have a family history, if you have no predisposing factor, if all the risk factors that have been mentioned earlier, you don't have any of them, then you should do a breast self-examination monthly. Breast self-examination monthly. So you examine your breast every month for lump. You stand in front of the mirror and you check all 4 quadrants of your breast for lump every month as a man, please. And then if you also do not have a risk factor for it, you should also do a clinical breast examination every 6 months. This you have to go to the hospital, and so for the doctors to help you do that every 6 months. I hope you found this information very helpful. Please subscribe and like for more health tips like this, and see you next time. Bye.